The House of Commons Standing Committee on Health. Today's meeting is televised. We're going to meet until 7 o'clock, or a motion for adjournment, whichever comes earlier. We have the minister until 6:30, so for 1 hour. And today's meeting is a briefing on mental health and addictions in Canada with Minister Bennett and senior officials. Today's meeting is taking place in a hybrid format pursuant to the House Order of November 25th, 2021, per the directive of the Board of Internal Economy of March 10th, 2022. All those attending in person must wear a mask except for members who are at their place during proceedings. In accordance with our routine motion, I'm informing the committee that all witnesses have completed the required connection tests in advance. We will now welcome our witnesses who are with us this afternoon and who have been patiently waiting. The Honourable Carolyn Bennett, Minister of Mental Health and Addictions from the Canadian Institutes of Health Research, Dr. Michael J. Strong, President from the Department of Health. We have with us in the room Heather Jeffrey, Associate Deputy Minister, and online Jocelyn Voisin, Assistant Deputy Minister of the Strategic Policy Branch, Eric Belair, Associate Assistant Deputy Minister, Strategic Policy Branch, Kendall Weber, Assistant Deputy Minister, Controlled Substances and Cannabis Branch, Jennifer Sachs, Director General, Controlled Substances Directorate, and in the Controlled Substances and Cannabis Branch, and finally from the Public Health Agency of Canada, Candice Saint-Aubin, Vice President, Health Promotion and Chronic Disease Prevention Branch. Thank you to all of you for hanging around to inform us and to wait out the votes. I understand that it's just the Minister providing an opening statement this afternoon, and Minister Bennett, welcome to the committee. You have the floor.
Merci, and thank you, Mr. Chair. Merci pour l'opportunité de comparaître.
Thank you for the opportunity to appear before the committee today to discuss my mandate and priorities. I would like to begin by acknowledging that I am speaking to you today from the unceded traditional territory of the Algonquin Anishinaabe people.
The whole team of public servants in National Public Service Week, and this is the wind beneath our wings, and we're very, very grateful. As I think most of you know, that the core of my mandate is to ensure that mental health care is treated as a full and equal part of our universal health care system. And so there can be no health without mental health. And since 2015, we've made historic investments to support the mental health of Canadians, including the $5 billion to the provinces and territories to increase the availability of mental health care, $598 million for distinctions-based mental health and wellness strategy for Indigenous peoples, $140 million to support veterans, $45 million for national mental health care standards, and $270 million for the Wellness Together portal. Through the $500 billion bilateral agreements with provinces and territories alone, our government will provide them with an additional $600 million of funding on an annual basis to support mental health care from now until 2027. And we want to reassure the committee that we're still fully committed to the additional $4.5 billion over 5 years promised in the 2021 platform for the new ongoing permanent mental health, Canada Mental Health Transfer. What we heard from early engagements with partners and community-based organizations providing these vital mental health services on the ground is that a new permanent transfer had to be built on appropriate transparency and accountability. So we are engaging with provinces and territories to inform the design of the new Canada Mental Health Transfer, as well as a comprehensive evidence-based plan, including the sharing on indicators and outcomes. Nous travaillons à l'élaboration de normes.
We are working toward national standards for mental health and addictions support so Canadians know what they should be able to expect in terms of timeliness and quality services, treatment, and support. Last March, we announced a partnership with the Standards Council of Canada, which demonstrated expertise in national standardization initiatives to develop national standards for delivering mental health and substance use services.
While the COVID-19 pandemic has exacerbated the gaps in mental health supports available to Canadians, it also accelerated the use of virtual care options to expand the availability and flexibility of those services. And I think, as we talked last time, the Wellness Together Canada online portal services provides the free 24/7 mental health and addiction services and resources to people in need across Canada, including one-on-one counseling. The new companion app called PocketWell will ensure Canadians have access to the mental health and substance use services they need no matter where they live. The overdose and toxic drug supply crisis has taken a tragic toll on the families, loved ones, and communities of those we have lost across Canada. Since 2020, our government has invested $282 million in the Substance Use and Addictions Program, which includes the $100 million that was in Budget 2022. Evidence shows that harm reduction measures save lives, and we have invested over $64 million specifically to expand access to safer supply of pharmaceutical-grade drugs and increase access to life-saving naloxone across the country. Substance use is a health issue. We are working to divert people who use drugs away from the criminal justice system to access adequate, supportive, and health and social services and build those truly important, trusted relationships. We recently approved BC's application to allow personal possession of small amounts of certain illegal drugs, which included a comprehensive implementation and evaluation plan. This proposal addressed the public health and the public safety impacts of this request and has the support of key law enforcement and will inform other jurisdictions as to any potential future national approach. So thank you for the opportunity to highlight some of the key aspects of my mandate, and I really look forward to expanding on my brief remarks through your thoughtful questions.
Thank you very much, Minister. We're going to begin with those questions now, starting with the Conservatives. Mr. Lake for 6 minutes.
Well, thank you, Mr. Chair, and thank you, Minister. I'm going to start for clarity. I just want to be absolutely clear that I'm not going to ask you about funding in the past for mental health related to previous spending, because I know that when I've asked these questions, that tends to be where you go. I'm going to ask about the platform, the Liberal platform, page 75 I'm looking at right now, the new investment promised here on page 75 of the Liberal platform under Canada Mental Health Transfer of $250 million for 2021-22. Could you please tell the committee how much the government actually spent in 21-22 for the Canada Mental Health Transfer specifically?
So I think, Mike, as I said in my remarks, that what has happened is that in the bilateral agreements with the provinces, there was a commitment. So in 2021, there was actual total of $600 million in new money and another $600 million in coming up, such that we are in 21-22, and that will be ongoing until 2027. $600 new dollars every year.
So just to be accurate, is it accurate to say that there was no money spent specifically for the Canada Mental Health Transfer in budget year 2021-22? Yes or no?
I think, as I said in my remarks, when we went out to the provinces and territories, but mainly to the stakeholders, they wanted it to be accountable and transparent, as they felt that the bilateral agreements maybe hadn't been able to show what you were getting for that money. So in choosing the indicators and moving towards what will be a plan built on national standards, and then the transfer will be sorted
To
out with data.
be clear, just to be clear, so the Liberal platform promised $250 million in 2021-22, $625 million for 2022-23. So that's $875 million that should have been spent or budgeted by now, specifically for the Canada Mental Health Transfer. I think what I'm hearing you say is that stakeholders asked not to spend that money in those 2 years. Can you please point to which stakeholders specifically asked the government to wait, to not spend that money right now and wait for later?
So what the stakeholders wanted was more money for the substance use and addictions program, money for the mental health promotion innovation programs, money for distinctions-based mental health, for money for veterans, and the $45 million to establish the national standards.
But the $875 million that was promised in the platform and not delivered yet, $875 million for a Canada mental health transfer. Which stakeholders have said, don't spend that money right now, we need to consult more? What specific stakeholders? Because you've pointed multiple times to stakeholder input.
I have been coast to coast in this country. There were concerns that the $5 billion in the bilateral agreements wasn't transparent and accountable for the money that was being spent. They wanted us to develop the plan, and they wanted us to work on that common statement of principles that the provinces and territories have worked on towards national standards, integrated youth services, the kinds of things that we digital
to be clear,
care
though,
integrated into primary care, and that they were worried that if the money went without the kind of rigor that is in the child care agreements, that we wouldn't be able to prove what works and what doesn't work, and how we fund what works.
To be clear, sorry, and I think, Mr. Chair, that the answer is supposed to be the same length as my question. So to be clear, the Liberal Party, the government, having been in power for 6 years, didn't consult with the stakeholders prior to making the promise in the 2021 platform?
I think there had not been a minister of mental health and addiction before this. I think the decision was that as being appointed minister, I needed to get out and talk coast to coast to coast with the grassroots, the people delivering the service.
But that wasn't the promise. But that wasn't the promise. The promise made was for so far $875 million to have been spent or budgeted by now.
And what I'm saying is we are totally committed to that $4.5 billion that will be over the next years. We need to get it right, and we need to make sure it goes to the...
So just to be clear, though, the platform promised that money to have been spent right now. So that was a mistake to have made that promise at election time?
I'm saying that the $600 million that the provinces and territories are getting now in the bilateral agreements, we are looking at how that money is being spent, and we want to make sure it gets results as we build the mental health transfer based on national standards.
Can you tell me what the current 24/7 suicide prevention hotline number is in Canada today?
I know that if I Google suicide on my phone, which is what happens to people now, is that they will get that number right away. And I know that we are committed to getting this done. And I think, as we've told you before, that there is a real interest in getting it right and learning from the experiment.
So, Minister, if you had a friend,
Mr. Lake, that's your time.
Okay.
Next, we're going to go to Dr. Hanley, please, for 6 minutes.
Thank you, Mr. Chair, and thank you, Minister Bennett, and all the officials for appearing today. And thanks for the hard work that all of you are doing. I'm going to, Mr. Chair, I would like to save the last 2 minutes of my 6 minutes for Mr. Morris to have a chance for a question, if you're kind enough to help me with that. Minister Bennett, I'm certainly very happy to see the BC exemption. I know you agree with me that this is not a BC only problem, the toxic drug crisis, and my constituency of the Yukon still has the highest or among the highest per capita deaths in the toxic drug crisis. And it's a crisis that touches communities across the country, families, parents, children, Indigenous, racialized people, young people everywhere. So I believe the agreement is a big step in the right direction. I'd love to hear your thoughts on the potential for decriminalization of personal possession in other jurisdictions in Canada, or and your thoughts on a future national approach. And particularly, have other jurisdictions already expressed an interest in pursuing decriminalization of personal possession in their regions? If you can update us on which ones. And maybe I'll stop there and let you speak to that.
Well, firstly, I want to thank you, Dr. Hanley, for your leadership on this. And I think that debate in the House of Commons really demonstrated that this crisis is touching members across the House and real people, that families and loved ones of parliamentarians coast to coast to coast. We do believe that the BC exemption is a huge first step in cracking open this big door and being able to do it in an evidence-based way with the appropriate indicators for public health, indicators for public safety, and to make sure that as we build that during the pre-exemption period into a process that will get us the data in real time in a dashboard and be able to evaluate in real time how we are making a difference and that it's still in the public interest. I have received an application from the Toronto Board of Health, and we are working with them. We understand many jurisdictions have passed motions, but we haven't got any other applications yet. But we do believe that they should be forthcoming from Montreal, Edmonton, and maybe the police forces in Saskatoon and Regina.
Thank you. And can you elaborate a bit on when you have or are expecting applications from municipalities, how that will actually work in practice, particularly as we gain experience from the BC example, when it's not the entire jurisdiction, the province or the territory that is actually pursuing the request.
Yeah, I think that what we will learn is that because of the BC exemption and because people have already seen what a successful application looks like, that they will be able to move more quickly on the kinds of criteria that we've been looking at. Diversion to health and social services, but ramping up those health and social services to make sure they can address the needs, to be able to engage with stakeholders, people with lived and living experience, for law enforcement, business, to make sure that consultation is ongoing, public education, law enforcement training, but mainly a process for the research and evaluation to see what's working and see whether any application needs to be adapted to get better results. So I think now that people see what it took to get the BC exemption approved, that it will really help the other jurisdictions. Obviously, things like law enforcement training would be individual in the jurisdiction. Sometimes the 4 drugs in BC may not be the drugs that another jurisdiction would want to have the personal exemption for. But Minister, I think as we work together.
If we're going to give Mr. Morris a chance,
yes, thank you very much.
This is the time. Go ahead, Mr. Morris, and welcome to the committee.
Thank you, Chair. Thank you, Mr. Hanley, and thank you, Minister Bennett, for being here. Many parliamentarians talk about mental health is health. And I think it's really critical that we ensure that we follow through on that. In my community, for example, it is a struggle. The connection between both housing and mental health is leaving many left behind. And so I turn to organizations like the Canadian Alliance on Mental Illness and Mental Health, the National Voice for Mental Health across the country. It's a member-driven alliance of 16 mental health groups. When they talk about the kind of funding that we actually need, they look to the Royal Society of Canada, talking about 12% of health care funding towards mental health. And so, Minister Bennett, can you comment whether you agree with the need for parity in funding on mental health? on whether that 12% amount is the amount that you're also striving towards and your actions you're taking to get us there.
I think, Mike, what you're saying is so important because I think there's a difference between health and health care. There is a difference between prevention, health promotion, but also the health and social services that keep people well. And so whether it's supportive housing, whether, what do we count? And in the kinds of approaches the provinces or territories, they know they need that social housing that, the Canadian Mental Health Association's been helping to design, the kinds of things that Minister Hussen is doing in rapid housing. Do communities have those wraparound health and social services that allow the federal government to buy the building? And so when we think of what are the expenditures on keeping people well, not just patching them up when they get sick, that I think that we see that dealing with poverty, violence, the environment, shelter, equity, education are all part of keeping people well.
Thank
Brief
you, Minister.
follow-up?
No, we're past time. Monsieur Garon, pour 6 minutes.
Mr. Garon, 6 minutes. Thank you, Mr. Chair. Thank you, Minister, for being here with us today. It's much appreciated. On March 10th, 2017, Quebec signed an asymmetric agreement based on the 2014 agreement, based on asymmetric federalism respecting the areas of jurisdiction of Quebec. The agreement for implementation includes home care, community care, mental health care, and addictions care. And that agreement ended in March 2022. In the campaign, the Prime Minister promised $4.5 billion over 5 years. In addition to those bilateral agreements, of course, the Bloc and the Quebec government are opposed. Where are these $4.5 billion in the budget? Where do things stand in terms of these funds? It's the first year.
Notre gouvernement a également promis d'assurer.
Our government has also promised new targeted funds for virtual care and long-term care. This is alongside the mental health transfer that will involve $10.1 million for Quebec. Minister, the $4.5 billion over 5 years for the bilateral agreement, where do they stand in the budget? Where are they? $4.5 billion over 5 years that were supposed to be as an add-on to those bilateral agreements that have just come due. Where do they stand? Where are they?
Maintenant, au Québec.
At this point in Quebec, I think the figures for that transfer of the 2018 amount of $5 billion, Minister, we're in 2022 right now. In Quebec right now, and we're talking about 2022, it's $134.99 million for 22-23, including the it's in the original bilateral agreement, but now provinces and territories are working together for the future of a dedicated transfer, Canada mental health transfer. I understand the figures just aren't there. Thank you, Minister, of course, but I'll get back to this in the budget. You plan to cooperate with the provinces and territories, and I quote, to create a new Canada mental health transfer. Where do things stand with respect to the negotiations? We don't hear much about them. Have you sat down with the government of Quebec? Has that begun?
Oui,
Yes, I had a good conversation with Minister Carmon. This is a very serious issue. I've also spoken to the addictions organizations and social services last week in Quebec with a member of Parliament, Soraya. It's really quite important to build a mental health plan from the ground up to really solve the serious problems out in the field. Thank you, Minister. Look, I'm pleased to hear it, but at the same time in your introduction, and I'm quoting, I grabbed a number of those keywords you're talking about: transparency, accountability, national standards, indicators, national indicators, the National Standards Council, no strings attached. Minister, do you know that that's not in your area of jurisdiction? Healthcare is not an area of jurisdiction for you. Do you know that Quebec and the 9 provinces are asking for an increase in the healthcare transfer that would be unconditional? It's very important for us to better understand that health is a shared issue. Healthcare services really fall within the area of jurisdictions of the provinces and territories. Prevention, the province of Quebec. Minister, you said it's a shared issue by using the federal spending power. That's how you've gone about doing things. That's neither within the spirit or the letter of the Constitution. If you'll allow me to finish, I'm the one asking questions, Minister. Minister, if you'll allow me, I have a question for you. You referred to federal funds spent to come up with national standards. How much does that cost so far? How much have you spent on national standards? Answer: $45 million, but with the support of the provinces. You're telling me today that the government of Quebec has asked you for national standards? Answer: Mr. Chair, I'd like the minister to table a document. Unfortunately, the interpreter's hearing several people at the same time.
Madame
la ministre,
There's one. People are speaking at the same time. Can you table a document proving that the government of Quebec has asked you to come up with national standards? Can you table a document confirming this official request? There is an agreement with the provinces and territories. Minister, I'm talking about Quebec. Answers: for these common standards in areas of shared priorities for responsibilities for these provinces. You're telling me that among those 10 provinces, Quebec has asked you to impose national standards? I'm not talking about these 10 provinces. I'm talking about Quebec alone. That's all the time you have. A brief response, no interruptions, please. It's a statement of common priorities. This is a common declaration in 6 areas with all the provinces and territories involved. It involves primary care, mental health care. Actually, Quebec is a leader when it comes to integrated services for people.
And I look to show you the leadership of Quebec on the integrated use strategy that has now 11 out of 13 jurisdictions right there with
Thank
this really exciting plan for the country.
Thank you, Minister. Mr. Johns, please, for 6 minutes.
Thank you, Minister, for being here. And just, before I get started, if you can be really brief in your answers, because I've got a very short period of time here with you. June 1st, the day after the announcement of a limited exemption to the Controlled Drugs and Substances Act for British Columbia, the Minister of Justice was reported to have said, quote, "There isn't at this stage any larger discussion on decriminalization," end quote. So my question is, why isn't this happening? Because it seems to be conflicting to what you're saying today, that you're open to the other applications that are coming. I guess what I'm wondering is what happens if a community like Dawson City applies? Are you going to support resources so they can actually get an application in? Or a small remote First Nation in Saskatchewan where they've got an overdose crisis, for example?
I am willing to really accept all applications, but the kinds of criteria that were in there for BC, like law enforcement training, like increasing the health and social services, we need to see all of those things in order for it to be a successful application.
Minister, in 2020, 73% of the people that died of a toxic overdose died outside of BC, and the stigma of criminalization will continue to cost lives across the country. Why isn't this conversation happening outside of British Columbia? And what are you going to do for those small communities that don't have the resources to do a comprehensive application like British Columbia?
Well, I think you and I have had this conversation before. We need the public safety criteria as well as ramping up the health and social services before we can actually begin that conversation. We have to
Minister?
know the health and social services are there, and we have to know there won't be any unintended consequences in public safety like gangs, organized crime, and the things that we have seen if you do not have a very strong implementation plan.
Minister, you had an expert task force on substance use. They were unanimous in saying that criminalizing people who use substances needs to end. Unequivocal. So I'm wondering, are your government policies, on this issue based on evidence or on opinion polls?
It's absolutely on evidence, but it's also on the evidence that we had from the frontline organizations that wanted to make sure health and social services were ramped up. You cannot divert people from the criminal justice system to health and services if they're not there.
Minister,
But
they were
also,
unanimous. Your own expert task force is unanimous. The evidence is clear. 27,000 people are dead. You don't need more evidence. You don't, Minister.
We need an implementation plan, and that's what we're going to get. We have to have an implementation plan in order to be able to approve these. And so I am very excited that the conversations I've had with that expert task force, people are excited that that big steel door has been cracked open, but it's going to be cracked open safely. We do not want to have what happened in Colorado.
Incrementalism is what's killing people on substance use and the government's response. People are dying. Look, I'm going to go to May 31st. You said safe supply is the real antidote to the toxic drug crisis. What are you doing to scale up safe supply so that it's available to anyone who's at risk of drug poisoning in this country? And Minister, I asked your colleague, Minister Tassi, the Public Services and Procurement Minister, if she's procuring any safer supply. You know what she told me? She said she's waiting for a request from the Minister of Health or yourself, and she hasn't gotten one. Why?
I think you know that's not how it works.
That's how she's told me how it works.
No, it's not how it
That's
works.
the Minister is on record at the Committee of the Whole saying that it requires a request from yourself or the provinces. So if a province requests safer supply, will you provide them with a safer supply?
at the moment-
And in COVID-19, we know, vaccines save lives, so does safer supply.
I agree with that, but I also agree we have approved diacetylmorphine, the injectable heroin at Health Canada, but the Pharmascience company is not ramping up to produce it. We need all of these things, but we need doctors to be able to prescribe it because there's lots of it out there. Dilaudid, what Christy Sutherland's doing in the downtown east side on powdered fentanyl.
Minister,
We've
you're
got
even saying
lots of
yourself that you
ideas.
can't access what you need. Why isn't the Public Services and Procurement Minister doing it? Anyways, I'm going to leave that with you because I've got more questions. Last May and June, the expert task force recommended Canada make significant new investments in providing a full spectrum of supports for people who use drugs or substances or who are in recovery. Do you believe the $100 million over 3 years in this year's budget implements that recommendation and reflects the scale of this crisis?
So the $100 million is for the substance use and addiction program. But over the past number of years, we've invested about $800 million in this, and that we know that the SUAP program is being hugely successful and is oversubscribed, and we will get that money out the door, and if we need more money, we'll go get it.
Minister, if you look at the comparable amount of money the government spent per capita on SARS, on COVID-19, and the deaths, it's not even comparable. Now, your party promised in its 2021 platform to spend $4.5 billion over 5 years on a new mental health transfer to expand services and address backlogs. It also promised to fund the 3-digit suicide prevention hotline. The House unanimously supported in 2019, a national suicide prevention plan as well. Yet none of these initiatives received any funding in this year's budget. When can Canadians expect to see action on these? I see I'm running out of time. Can you provide in writing to this committee, when that's going to happen and who you're consulting on the Canadian mental health transfer?
Sure, absolutely. Well, I'll be happy to put out a plan for you, and I think that even on the 3-digit, as you know, the United States is just a little bit ahead of us, and we're going to learn.
Parliamentarians need a timeline. They need it in writing. They want a commitment.
Mr. Johns, I was going to let the minister finish, but you interrupted her. If you have anything else you want to add to that answer, and then we're going to go to Mr. Lake.
No, I think
Okay.
I'm actually happy to put it in writing, Mr. Chair.
Thank you.
Chair, just for this next round, would we be able to just get you to flag at the halfway mark for split time between Mr. Lake and Dr. Ellis?
Absolutely.
Thanks.
The floor is yours, Mr. Lake, for 2.5 minutes, and then we're going to go to, is it Dr. Ellis? Yes, sir. Yeah. Go ahead, Mr. Lake.
Okay, Minister, a couple weeks ago, I asked a question in the House that was a very legitimate question. You referred to my question as annoying and despicable. What I find more than annoying, maybe not despicable, but completely unacceptable, is that 3 months ago, I asked you what the suicide prevention hotline number was, and you didn't know it then. As the minister responsible for mental health and addictions in this country, people would expect you to know what the suicide prevention hotline is. And just Google it could not be a more unacceptable response when you're talking to Canadians who are at risk of suicide. Do you recognize that?
I'm saying that most people now really do just tap on their phones the number. So
what if somebody asked you what the suicide prevention hotline is? In crisis, and you wouldn't have it. The stakeholders, if you talk about consulting the stakeholders, if you ask them, they would say that we need a 988 suicide prevention hotline. It's been 550 days since we unanimously passed a resolution on that. It's completely unacceptable that we don't have it. Just for reference, what is the three-digit proposed
the United
three-digit
States has
suicide
worked
prevention
4
hotline?
years
Minister,
on this.
just let him finish, and I'll give you the equal amount of time. Go ahead and finish your question there, Mr. Lake.
Well, I did. What's the three-digit hotline proposed? What's the number?
Say that again.
What's the proposed three-digit hotline number?
988.
Right. So you know that off the top of your head.
Yeah, but do you know that in some of the rural parts of Canada, 988 is the beginning of a 7-digit number, and that that CRTC and people have to sort this all out. Because it does. Some places in Canada are 7 digits. Some places in Canada are 10 digit. This is unraveling.
Yes.
And many places I go don't have enough people answering these calls.
Thanks.
We have to make sure this is when you push start that it'll work. The United States has spent 4 years doing this. When they start in July, we will be watching very carefully because I think everybody is very worried about the capacity to not let people down.
The unanimous consent motion and the promise you made in your platform wasn't to watch very carefully what happens in the U.S. It was to establish a 3-digit suicide prevention hotline. It's been 550 days. How many more days do you need?
So, Mike,
Okay,
we're not
very
waiting
briefly,
for,
Minister,
we're not
because he
waiting
wants to
for
split
the
his time and he's
CRTC.
at the halfway
We're
mark.
not waiting for anything. We are working every day on building the capacity to make sure that when we push start, that there will be the capacity to answer this coast to coast to coast.
You just said you
Minister.
were waiting.
Thank you, Mr. Lake. If you still want to split your time, you're past it. Over to Dr. Ellis.
They know they will have some wrinkles.
Dr. Ellis, please.
Thank you, Mr. Chair, and through you to the Minister. Minister, can you tell us which country is the biggest threat to Canada with respect to importing fentanyl?
My evidence is a lot of the fentanyl's being made here now.
Okay. Well, that's probably not what experts would say. That being said, it's coming from China, and that's a very important thing. Maybe I'll come back to it. Usual dose of fentanyl in medical procedures. I understand you're a physician, perhaps not practicing for a while. If you don't know it, that's okay. Nope. Fentanyl, 100 micrograms. 2.5 grams of fentanyl would be enough to treat how many people? I'll give you the math just so we can move through this. 25,000 people. 25,000. So we're allowing people to possess enough fentanyl of medical treatment doses for 25,000 people. How much Narcan do we expect the police to actually carry around? Are they going to fill paddy wagons full of Narcan doses? Nonsensical. How could we possibly say that that is an appropriate amount? 25,000 medical doses of fentanyl.
I think, Doctor, you know that what is on the street is not pure fentanyl. It's been cut with all kinds of other things, and that is the reason it's so deadly now.
Okay, well, let's say it's 10,000.
Diazepams. It's filled with all kinds of things that Narcan doesn't even touch.
Okay, 10,000 doses. Is that appropriate?
Doctor, I think that the fact that we have all the law enforcement agencies on side with this, as well as public health, means that we are beginning by beginning. We're going to start by starting, and that, as you know, the original BC application was 4.5. The Vancouver approach had different amounts for different drugs. This is the police have asked us to have a cumulative amount, because it's much easier to enforce.
One more question. Interestingly enough, could you please table the documents that really justify the 2.5 grams of fentanyl, please, Minister, for this committee?
I think I've just explained that 2.5
No, that's not what I asked, ma'am. Could you please table the documents?
I'm going to tell you that I can table the documents that show that...
No, that justify the 2.5 grams of fentanyl, 25,000 treatment
That is not
doses.
what we
Okay, you're
approved.
past time, Dr. Ellis. Please let her answer, and then we're going to move on. Go ahead, Minister.
We approved 2.5 grams cumulative of whatever a person is carrying. And as you know, there are many people using drugs who think that many people using drugs would use that. We are also getting criticism from the people using drugs that that's not enough in terms of what people's daily dose would be of the street version of it.
Okay. Thank you, Minister. Next, we're going to go to Ms. Briere for 5 minutes.
Merci, Monsieur le Président, et merci,
Thank you, Mr. Chair. Thank you, the Minister,
cet après-midi.
and the officials for being here.
The Minister, in your remarks, that the development of national standards for mental health and substance use services is a key component of your mandate. Can you expand on why this is so important for you?
Well, thank you, and I'm happy to talk to my colleague, Monsieur Garon, because what happened was the provinces and territories came together on what they called a common statement of principles as priorities that were their 6 priorities: integrated youth services, primary care with mental health, digital health, substance use treatment, substance use human resources, and that kind of integrative care for people with complex problems. So now the Canadian Standards Council is working with all the stakeholders to work on those things that the provinces and territories have identified as their priorities. But as we get out across the country, there are many other things that we're hearing: appropriate detox and withdrawal, the kinds of standards that exist where whatever province you're in, Mr. Garon, it's the same treatment for blood pressure or for cancer. For mental health, there haven't been those kinds of standards, and that's why I think people want those kinds of practice guidelines on the kinds of things like perinatal mental care. What should people be able to expect wherever they live in Canada, and then how do we build that into a plan and then build the transfer on that?
Thank you. And so what specific areas will the standards for mental health and substance use deal with? How will these national standards be set then?
So I mentioned the other ones, but the one that I'm most excited about, Elizabeth, is integrated youth services. It's been led by Quebec and Ontario, but mainly the building on what was started in British Columbia as the Dr. Stephen Mathias and the Foundry. Integrated youth services means that it's a wraparound service, so the young person can get peer counseling, primary care, social work, addictions counseling, help with housing, help with education, help finding a job. And so these integrated youth services are now signed on to by 11 of the territories, and I think that we will be able to show not only the benefit to the young people, but the economic benefit to having this kind of integrated services coast to coast to coast. It's a hugely exciting movement across the country.
Budget 2021 provided $45 million in funding for the development of standards. How is this funding being allocated?
So as the Canadian Standards Council is not the expertise body. But where there's been an identified need for a standard, then they use dollars to get out and talk to the people on the front lines, talk to the organizations, talk to the people with lived and living experience, and be able to come together with what really would be, as we say, the most appropriate care in the most appropriate place by the most appropriate provider in the most appropriate time. What should that standard of care and quality be?
About now the opioid crisis, can you tell us what was your discussion with the British Columbia province, and where are you at now fighting that so important crisis?
Thank you. What's exciting about working with British Columbia now is that they now have put together a table on the research and evaluation on this project. And out of that table, we will be together developing the indicators both on public health and on public safety to be able to demonstrate what works and the efficacy of the exemption, that it remains in the public interest. But if we have to adapt, then we will adapt. And so that's the work we're doing now, as to from now until January 31st, what will be the process. And then Canada is setting up an arm's length process with CIHR to be able to not only be able to work with British Columbia, but to use the learnings in real time so that we can help the other jurisdictions have a much more rapid approach to a successful application.
Thank you, Madame Brière. Suite, Monsieur Garand pour...
Mr. Garand, 2.5 minutes. Minister, I understand you were quite surprised by your colleague's question. It's not because the province has announced 6 priorities in health that means that they're common and that they've asked you for conditions for financing or funding, rather. You should stop saying that because it's false. Let's talk about C5 that includes measures for individuals who have addictions issues. Of course, the people who testified during hearings on C5, the groups were saying that there weren't enough resources to support these people who are in distress. These amounts for Quebec are usually distributed through the Canada-Quebec Contribution Agreement on the program for substance use, because, of course, it has to be recognized that Quebec has its areas of jurisdiction. There is asymmetric federalism. It needs to exist. Where do you stand today? Where do the negotiations with Quebec stand today? So Quebec can have its share of these funds through the agreement.
Oui, mais aussi...
Yes, but the bilateral agreement with the province of Quebec also establishes programs. Sorry, Mr. Guérin, you asked a question. It took a minute, and you interrupted the minister. Mr. Chairman, after 20 seconds, she has the right to take as much time as you took to answer your question. Go ahead, Madam Minister. The agreement with the province of Quebec is not just about the $5 billion for the provinces and territories. There's also the issue of projects in communities, like substance use projects or projects on innovation, like in Madame Brière's riding. It's always designated by the province of Quebec or the National Public Health Institute. This is a priority that is a provincial priority. In the other provinces, it is not the province's priority. It's thank you, Minister. Thank you, Minister.
Projet pour les fonds.
Question bref.
A brief question, Mr. Garon, and a brief answer, please. Mr. Chair, as the Minister did not answer my question, I will ask her again. That $100 million over 5 years, provided in the budget, where do things stand with respect to negotiations with Quebec? So the Quebec portion will be handed over through the Canada-Quebec Contribution Agreement as to the Substance Use and Addictions Program. Where it can't be more specific than that, where the negotiations stand. A brief answer with no interruption, says the chair. As to bilateral agreements, it is a transfer. It is no strings attached.
Tom,
Thank you. That is your time.
2.5 minutes, please.
Minister, on May 31st, you said in a statement, quote, "Together we will end this tragic crisis so that no more families, friends, or communities will lose a loved one to a heartbreaking overdose." Do you believe your government has a credible plan to end the thousands of deaths that we're seeing across this country each year?
I believe that we now, with the Canada Drug Strategy, that we actually are working very hard on the prevention, on the treatment, on the harm reduction, and on the law enforcement, and that we are building towards that plan. But we are doing it in partnership with the provinces and territories and with all the communities to be able to do what they can as well on the ground, and that we respond to their needs. Yes.
I think Canadians need to see the plan. I want to know your plan is to ensure all Canadians dealing with substance use disorders can access publicly funded, evidence-based treatment on demand.
Well, I think, as you know, Mr. Johns, one of the problems we need. Well, it was very interesting in the conversation with the College of Family Physicians that the College of Family Physicians. I did a training program that was only 2 years long. They're now considering having a project having a residency program that would be 3 or 4 years, because they want the capacity across the country to be. They do not believe that that family doctors coming out have comfort with mental illness, with addictions, with pain.
Minister,
and so
like other
we need
countries
to
have.
Increase that mental health human resources, including family doctors.
Yeah, well, we need a plan. We need a plan to do that. Like other countries have actually had courage and they've committed resources, like in Portugal, like in the Czech Republic, in Switzerland, in Germany, to go on the list. You know, I could keep going. We don't have a plan. Where is the plan? Anyways, Minister, I also want to know what, some provinces are, reject the importance of harm reduction, and they won't seek exemption to decriminalize, for example. Some communities might within those provinces. How will you ensure equitable treatment of people who use substances across this country?
Well, I think that this is going to be, it's what happens in British Columbia, I believe, will be a very important model for the rest of the country. We hopefully will be able to demonstrate that works. It saves lives and it keeps communities safer.
It's a trial group in BC and a trial group in the rest of the country. Is that what you're doing? Will people die at this pace?
What we are doing is, just as Mike said, we're building supportive housing. We're building all of the elements in partnership with the provinces and territories. But so many of the projects go straight into the municipalities so that we can really save lives with the substance use and addictions program, the mental health promotion innovation funds. That we are really then doing the proof of concept that provinces and territories can pick up and run with when it's shown that they work.
Thank you, Mr. Johns. Thank you, Minister. Next, Ms. Goodridge, please, for 5 minutes.
Thank you, Mr. Chair, and thank you, Minister Bennett, for your testimony here today. To just carry on along some of the similar lines to what you've heard from some of my colleagues, I believe strongly that decriminalizing without having any appropriate access to treatment is akin to putting the cart before the horse. Mr. John talks about Portugal, but in Portugal, they effectively made drugs, they were still illegal, it just was no longer a felony, and they had a very ample treatment space available. So what investments are you making to have more access to treatment in British Columbia, or are you hoping that we end up like Colorado, which has been an abject failure?
Well, again, as we move, working with provinces and territories, certainly what we felt in British Columbia that they were building up the health and social services to deal with the issue in a very appropriate way, as well as the harm reduction programs, the prevention, as well as the training of law enforcement. So those 4 prongs of drug policy, I think, are very important. And I think that treatment still is the purview of provinces and territories, and we are helping them with that bilateral agreement in the $5 billion where they get to spend it on their priorities, but and then as we build on the national standards, one of the common in the common statement of priorities of provinces and territories, substance use treatment was one of their priorities, and then we will have a national standard.
Thank you, Minister. I know that's definitely treatment of substance use has been a very large priority in the province that I come from, Alberta. There has been large investments in treatment. And when you were making your comments earlier, you said that the reason why you picked the 2.5 grams was that it was easier for law enforcement and that Vancouver had asked to have a difference depending on which substance. So you picked 2.5 grams, not necessarily based on medical evidence, but instead based on availability to help law enforcement enforce?
Working with both the public health experts and the public safety experts, 85% of the drugs that had been confiscated were less than 2 grams. But the people
Minister,
on the street were saying that some people there use 3, 4.
Minister,
Yeah.
Minister, I very well understand. But so was this a decision that was made based on medical evidence, or was this a decision based on people that are suffering from addictions telling you that they want more drugs?
This was a decision that was taken very carefully, both with public health and public safety. The fact that the Canadian Chiefs of Police, the BC Chiefs of Police, that the Deputy Commissioner of the RCMP have all said very positive things about this as being a good first start.
Okay, but was this based on medical evidence?
I think the medical evidence I heard was particularly the people dealing or serving people who use drugs. Some of those people were saying that people will use way more than this.
Okay, but is this based on medical evidence, or was this based on hearsay and how people are using this?
I can promise you it wasn't based on hearsay. It was based on the dual responsibilities I had for mental health and public safety.
Thank you, and I will cede the rest of my time to Mr. Lake.
Well, thank you. Thank you to my colleague. Thank you to the minister. And I'd like to use my time to just move a motion that the committee requests the minister to table all documentation confirming that it has met its commitment to fund a Canada Mental Health transfer as clearly outlined on page 75 of its 2021 election platform.
Okay, thank you, Mr. Lake. Just give me 1 minute. All right, the motion is in order. The debate is now on the motion. Dr. Ellis.
Well, thank you, Mr. Chair, and certainly to my colleagues, realizing that this has been an exceedingly contentious issue with the minister here with us today, and an expectation, I think, that all Canadians who suffer with mental illness and really we're looking for a significant funding transfer and hoping for that, is certainly supported by the Canadian Mental Health Association as well. I think that understanding where is the $875 million in view of the approximately 1/3 of Canadians who identify as having mental health issues, that this would be a very, very appropriate topic to understand here in Health Committee. And since it would appear very clearly that the government has not fulfilled their obligation to provide this, not in 1 year, Mr. Chair, but in now 2 years. And I guess that from my perspective, $875 million, almost $1 billion, let's be honest, $1 billion is missing and committed and is not being provided for the treatment of Canadians, which we also know that mental health has suffered even more significantly since the pandemic, and certainly ongoing since then, especially with the threat of perhaps future lockdowns that we hear from the government on an almost daily basis. So I think this is very germane to committee business, and certainly hope that my other colleagues from the other parties would support this motion. Thank you, Mr. Chair.
Thank you, Dr. Ellis. Mr. Johns, please.
Could we get you to repeat the motion and or send us the motion?
I think it was Mr. Lake that moved it. Mr. Lake, do you have the text of the motion that you could read into the record?
Interestingly, I wrote it down after I said it because I was kind of saying it on the fly here because I think that it's important. But I don't know if the clerk or one of the analysts want to read it back. I've written down what I think I said. Of course, the record will say what I actually said. So I believe that what I said was the minister tables with the committee all documentation, which confirms that it has met its commitment. Let me just pull this up. Met its commitment to fund a Canada mental health transfer as clearly outlined on page 75 of its 2021 election platform.
Okay. Yeah, that's what that's consistent with my recollection of what you said, Mr. Lake. Okay, colleagues, just Mr. Johns is next on the speaking order, but the minister is committed to be with us until 6:30, and it is now 6:30. So I'm going to take this opportunity as we continue the debate.
Point of order, Mr. Chair.
Go ahead.
Can I just say that if the minister was to commit to this, it would make our vote really easy.
Thank you. Minister, thank you so much for being with us. We had a lengthy delay. I know you had to move other things around. You responded very promptly to our request that you appear. We are grateful for that. And I don't want to further impose upon the time that you've set aside for us. So it looks like there's going to be some further debate on the motion. If you have anything you want to say before you go, please say it, and then we're going to move on with the motion. Thank you.
No, I think I just wanted to reiterate what Minister Duclos said last week in terms of the significant increase in the Canada Health transfer, as well as the $600 a year in the bilateral agreements from 2018. So we can very easily document what has gone to provinces and territories, but also what is in the substance use addiction programs, the mental health innovation, and I'm happy to give you what we have.
Thank you, Minister. Mr. Johns, please.
Yeah, just because I'm worried too about time. Like we've got half an hour with the senior staff and questions, so I move the vote that we vote right now on this.
Ms. Briere, please.
Merci, Monsieur le Président. En fait, juste avant de passer au vote.
Thank you, Mr. Chair. Before we vote, I just wanted to reiterate that it's been said many times that mental health is part of health. And we've made historic investments since 2015, $5 billion for the provinces and territories to increase access to mental health care, $598 million for distinctions-based support for Indigenous groups, veterans support, national standards support, as the minister has said, and $270 million for the Wellness Together portal. I think that shows our commitment in this respect.
Merci, Madame Briere.
Thank you, Madame Briere.
Interventions? Seeing none, we're ready for the question. Okay, I think we're clear that this is as was indicated a couple of times, a request from the committee for the tabling of documents.
A recorded vote too, please, Mr. Chair.
Okay, Mr. Clerk, if you could please proceed with the vote.
I'm happy to provide a written response. We'll be able to let you know what there is.
Well, that should make the vote really easy. Thank you, Minister. Go ahead, a recorded vote.
Recorded vote on the motion of Mr. Lake. Mr. Hanley.
I vote yes.
Mr. Johari.
I vote yes.
Mr. Pulowski.
Yes.
Thanks for coming in.
Ms. Sidhu.
Yes.
Madame Brière.
Oui.
Mr. Barrett.
Yes.
Mr. Ellis.
Yes.
Ms. Goodridge.
Yes.
Mr. Lake.
Yes.
Mr. Caron.
Pour.
Mr. Johns.
Yes.
Motion is carried. Now we're going to continue until 7 o'clock with questions for the officials, and the next person to pose questions is Ms. Sidhu, please, for 5 minutes.
Thank you, Chair. Thank you, all the officials, for being here with us. So my question is that it's not common for all communities to have an open conversation about mental health. I know this government is working to break down the stigmas, but recently there's investments for mental health happening for the distress center, including Brampton's South Asian Canadian Health and Social Services, which provides culturally appropriate services because it's much needed to address this mental health issue. How this government is working to support communities with culturally sensitive mental health services, especially when it comes to for the youth services?
Thank you, Mr. Chair, for the question. Indeed, social determinants of health are key to the response, and we know that many of our programs and our experience during COVID-19 show that communities from different backgrounds experience the pandemic and experience the mental health impacts very differently. For that reason, we've emphasized the importance of disaggregated data, consultations with communities to make sure that their needs are reflected and the data is shared. We've established programming that is available in a wide variety of languages. For example, Wellness Together Canada provides mental health services in over 200 languages, including 24 Indigenous languages. Our public health agency colleagues have an extensive program of outreach and programming in communities in their languages and responding to their needs. So I'd like to pass this to Candace Saint-Aubin, who is our Assistant Deputy Minister responsible for that programming, just to comment on the specifics.
Thank you very much, Mr. Chair and Honourable Member, for the question. Yes, we do have directed interventions for mental health promotion and prevention of mental illness, as well as trauma and PTSD in those populations that have been most impacted in COVID-19. That would be $100 million over 3 years within the mental health promotion space, but as well as $50 million over 2 dedicated to PTSD and trauma-informed. And these are directly in community, being developed and delivered by community members in obviously language and cultural choice that best impacts and supports their community members.
Thank you. And how important has virtual care been in assisting Canadians with the mental health with the virtual platform like Wellness Together Canada and Pocketville?
So especially in the light of the COVID pandemic, virtual healthcare services have become even more important, especially when people weren't able to receive them in person. Wellness Together Canada was one of the government's responses to that need. Through an investment of $270 million, Wellness Together Canada was able to provide 6.9 million individual sessions to over 2.4 million individuals by phone and by text. We've recently launched PocketWell, which is the app-based mobile application, allowing Canadians to access services whenever they need them from wherever they need them. The evaluations of that program were very positive. Over 88% of those who used the services said that they felt better, and 41% of those Canadians said that they would not have been able to access services any other way. But virtual care has many other uses in the healthcare space, and we have diverse programming. I'll just ask Joe Voisin to comment a little bit on the broader virtual care space.
Yeah, for sure. So through the pandemic, the provinces and territories have really moved to implement virtual care, recognizing that Canadians still needed access to care services, and the federal government supported them in that space with a $240 million investment. And there's bilateral agreements with each of the provinces and territories to help them advance virtual care and implement that in their jurisdictions. And mental health, of course, is one of the main areas that is benefiting from virtual care access.
Thank you. We know when addressing the mental health, having access to the community service is essential. Recently, the announcement happened, $8.6 million for 6 projects across Ontario to promote mental health and well-being in our communities. Can you expand on how these projects will help to improve mental health outcomes for our residents?
So one of the things that we've discovered is that it's really important that services respond to the most local needs, and different communities have different challenges that they're facing, and it needs to be provided in an accessible way. We saw this throughout the COVID response when Canadians responded most directly to services being offered by those close to home organizations within their communities. Stigma is a serious concern, and we want to make sure that people feel as comfortable as possible in reaching out, and that means local care that from organizations and community members that they recognize and feel comfortable dealing with. We have a wide variety of programs, the Mental Health Innovation Fund from the Public Health Agency, the Substance Use and Addiction Program. These all fund local level community response across the full toolkit of services that we need to respond to mental health and addictions.
Thank you, Ms. Jeffrey. Thank you, Ms. Sidhu. The next round of questions is going to come from Mr. Johns because the Conservatives and the NDP have traded turns. So, Mr. Johns, you have the floor for 5 minutes.
Well, thank you. And thank you to my colleagues as well. A question on mental health. What steps is the government taking to scale alternative approaches to police response involving mental health and substance use issues, such as including peer support workers, mental health nurses, and other trained mental health care professionals?
Thank you for the question. So as we were saying, it really takes a very broad toolkit to respond to all the different dimensions of mental health needs. And it requires a full suite of wraparound services, including working with law enforcement and others who are dealing with people who have multiple needs across the spectrum. We've been holding multiple consultations cross country with different groups, stakeholders, communities, who are involved in dealing with treatment and substance use issues. We are working on consultations to overhaul the Canadian Drug and Substances Strategy and to refresh a mental health strategy that is going to allow that full suite of integrated services. I'll maybe pass the floor to Eric Belair.
Spread it around, but I don't have time. In December 2021, PHAC released modeling that projected toxic drug supply related deaths may remain high and possibly even increase through the first half of 2022. At the time, PHAC released a backgrounder that said, quote, as opioid use and related harms have changed significantly over the past years, and especially during the COVID-19 pandemic, this model will be updated on a quarterly basis. Despite that statement, no updated modeling was published in March, as anticipated. In fact, the updated modeling still has not been published. In June 1st, MPs voted on my private member's bill to proposing a health-based approach to substance use without having access to the latest modeling to inform their decision. Why did the agency not fulfill its commitment to provide this modeling on a quarterly basis?
The agency is indeed conducting modeling, and I will pass the floor to my colleague Candice St-Aubin to speak to the data.
Yes, thank you very much for the question, Mr. Chair. The Public Health Agency did in fact release its modeling projections in March and will be as well releasing the upcoming quarter, I believe in the next 5 or 6 days. And I'm happy to provide the modeling linkage to where the modeling is posted publicly on our website to the honourable members here at the committee. Thank you.
Okay, we don't see it. We don't see it, actually. So look forward to finding the link to it.
Sure.
How many people are you forecasting that are going to die in the next half of the year from a toxic drug supply?
So out of toxic drug supply, not to get ahead of course, the modeling that's happening. I will, again, have to provide that in writing because, again, this has not yet been released publicly, and we're still analyzing the data and what's the modeling showing us.
So what we can find is that you've provided the updated amount of deaths, but not the projected moving forward. Anyways, look forward to getting that sent to this committee. Last week in the supplementary estimates presented to the Committee on Government Operations, that the agency requested $1.4 billion. No, I'm actually going to go back to, $1.4 billion for the procurement of additional COVID-19 therapeutics and related costs. As the agency discussed or sought funding for the procurement of pharmaceutical-grade alternatives to controlled substances.
Honourable Member, Mr. Chair, this is not part of my area of expertise. As happy to talk about mental health programming and program to support mental health promotion, but I refer or can defer and provide information in writing on that from the doctors within the agency.
Here's a question. On the perinatal mental health strategy, what is the timeline delivering on that?
For the perinatal...
I will... Oh, sorry.
I was going to say for the perinatal mental health strategy, I would refer to our colleague Eric Belair, who's the ADM for mental health.
So thank you for the question. So as you know, this is a key commitment in the mandate letter of Minister Bennett. She has started to engage with stakeholders on what are some of the models of care that we can be able to spread and scale across the country to help improve perinatal mental health services. And this is an area that will be part of our broader action plan to help improve mental health services in Canada. So there's already been one roundtable that Minister Bennett has held with experts and stakeholders, and she's going to be building on that to be able to develop further measures to be able to improve care.
Thank you, Mr. Johns. Thank you, Mr. Belair. Next, we're going to go to Mr. Johari for 5 minutes, please.
Thank you, Mr. Chair, and thank you to the officials for staying back with us. And thank you for the work that you're doing. I'm going to focus my questions on the youth mental health. I'm not sure who would be the best person, but let me ask the question, and I'm sure, Madam Jeffrey, you will guide us to who would be the best person to answer those. As you know, the pandemic has hit everyone, every Canadian, and everyone across the world, and especially among the youth. It's exacerbated in a worse way. We know that there were issues before for the adolescents, and we know the isolation and the lack of social activities has heightened some of those mental health issues. Can you tell us what the government is doing to address the increasing mental health needs for young Canadians?
Yes, thank you, Mr. Chair. So as already discussed, the mental health of Canadians definitely has been adversely impacted by the strain of the pandemic. Health Canada is providing core funding to the Mental Health Commission of Canada, who are established mental health national standards for the mental health of post-secondary students. In budget 2021, we also provided $100 million over 3 years to address the mental health impacts of the pandemic, in particular for vulnerable groups, including youth. We provided additional resources for Kids Help Phone, crisis line, that our public health agency colleagues can comment on further, that provides additional support to children in crisis. We have also provided funding for a campus peer support program at post-secondary institutions to provide direct peer support to students in need. We have held extensive consultations this year with the universities and colleges, and are working with different youth groups, including through integrated youth services organizations such as the Foundry, to talk about the full suite of wraparound supports. It's not just mental health services and counseling that are required, but a full suite of supports in areas such as housing and other social supports for students in crisis. And the needs vary across the country. So it's a comprehensive approach that we've been taking. And this is definitely one of our top priorities in the transfers that we provided to the provinces and in their agreements. They've all committed to invest in integrated youth services as a matter of one of the three priorities for those transfers. And we're midway through that 10-year transfer process.
Thank you for that explanation. Can you explain how the funding that was announced earlier in Ontario this week through the Mental Health Promotion Innovation Fund will support children's mental health?
I'll turn to my colleague, Candice Saint-Aubin, who Public Health Agency administers that fund.
Thank you very much, Honourable Member, for the question. So this funding will go to support those youth at risk, be it LGBTQ2 plus youth and those racialized or more vulnerable youth, including Indigenous youth. They will be developing interventions and supports directly within the community level. And we look forward to providing or coming back with more information once we have, including some key indicators and outcomes of success for these projects as they begin to roll out and we monitor and look for those impacts.
Thank you. With about a minute and 15 seconds left, I'm going to go back to Madam Jeffrey. Can you expand on the innovative or particularly successful model for supporting youth mental health? I understand that there's been significant success with an integrated youth services. I think the minister also mentioned that not only in her opening remarks, but also in response to some of the questions that my colleague raised. Can you explain on why this approach is so promising? Thank you.
Yes, thank you very much. Indeed, the standard on integrated youth services and the work that is being done coast to coast in this country on integrated youth services is extremely promising. It isn't enough just to provide addiction supports, but we also need other kinds of public health supports. We need social supports. The youth need counseling. They need access to peer groups. They need a variety of training and educational supports. All of those things need to come together to help an at-risk youth or child. I'd like to turn briefly to Dr. Strong at CIHR, who is funding a lot of the work and leading the work on standards for integrated youth services. So, Dr. Strong.
Yes, and thank you very much, Mr. Chair, and for the honourable member for the question. You are quite correct. There's been some really impressive outcomes through the integrated health youth services, really beginning in its inception in 2012. But just to give a measure of that, it's a unique way of reaching out to adolescents and children with mental health issues. Over 7,500 interventions, even as of 2020. And from that, 70% reduction in stress for the children and young people, and a 66% reduction in the degree of severity. And actually, by using those routes, almost a tenfold savings in terms of the cost of bringing young people in for services where they could be dealt with and treated more closer to home. So an incredibly successful program.
Thank you, Dr. Strong.
Thank you.
Mr. Johari. Ensuite, Monsieur Garon pour 2 minutes et demie.
2.5 minutes, Mr. Garon. Thank you very much, Mr. Chair. I'll let you redirect the question to the best person. In August 2020, the Director of the Public Prosecution Service of Canada issued the directive not to arrest people for simple possession. That would mean some savings for the administration of justice. It's also one of the central arguments to diversion programs based on C5. Has there been an assessment of legal costs and administrative burdens as to the savings involved in the implementation of C5? Do we have figures on that?
C5, this is a justice-led bill. It's not really within our peer review. What I can say is from a public health perspective that we certainly support an approach that takes a public health approach to addictions as a public health challenge and not as a criminal one. That was reflected in the action that we took, the minister took in approving the exemption for BC. But unfortunately, I'm not in a position to comment on Bill C5.
Je comprends, mais
I understand.
la déjudiciarisation.
But this concept of diversion is to make the problem go from the criminal law side to the healthcare side. That's the principle. It's really a public health issue. Do you think it would be appropriate at the Department of Health to try to assess what the savings could be, what savings could arise? Because ultimately, treatment for these people will be provided by the governments of Quebec and the provinces that will have to take on these additional expenses. Do you not think it's appropriate to do that those calculations at the Department of Health?
In our discussions on decriminalization and specifically on the Section 56 exemption in BC, certainly one of the views expressed by law enforcement colleagues at those consultation tables is that decriminalization of small amounts of personal possession allows law enforcement to redirect resources where they are most needed, and in particular to focus on trafficking and some of the other serious criminal harms that come as a part of drug trafficking, and that decriminalization in that sense allows law enforcement to focus their resources where they are most needed. So I can say in terms of the public health approach, that's really the area of focus that we've looked at when we're considering applications for exemptions.
Thank you very much, Ms. Jeffrey. Merci, Mr. Caron.
Thank you, Mr. Caron.
Next, we're going to go to the Conservatives to take us to the top of the hour. I believe Mr. Viss is going to lead off. Mr. Viss, welcome to the committee. It's good to see you again. You have the floor.
Oh, Mr. Casey, great to see you too. Madam Jeffrey, you were just mentioning the BC agreement. And of course, that's top of mind for me as a British Columbian MP. Do you think 2.5 grams of fentanyl is a amount used for personal use, or is that an amount rather that someone would be used for trafficking?
So the 2.5 gram exemption is what law enforcement have indicated is a majority level of drugs seized. So around 85% of drug seizures are at a level below 2.5 grams. Most of those drugs are mixed. As the minister indicated, pure fentanyl in those quantities is not a substance that would be used for personal possession, and the exemption process and the exemption itself provides clear authority for law enforcement to take action wherever trafficking is suspected, and certainly that level of possession would indicate trafficking, and in no way does the exemption fetter.
Thank you. Did law enforcement specifically, did BC law enforcement specifically ask for a 2.5 gram exemption for fentanyl?
The proposal from British Columbia was the result of consultations at a table that involved all stakeholders, including law enforcement. But
Health Canada didn't specifically undertake consultations with BC law enforcement before approving the exemption.
Health Canada considers the exemption proposal that is presented to us by the provinces, and we evaluate it from a public safety and public health approach according to the responsibilities under the Act.
Under the Act, they made specific reference that these exemptions wouldn't apply on school grounds. Do you believe that law enforcement currently have the ability in British Columbia to actually enforce an exemption on school properties?
So there's a period of coming into force. The exemption will not come into force until the end of January 2023. The intervening period is a period of intensive work, and we'll be accompanying the province of BC in this process. And one of the main areas of work is provision of guidance and training to law enforcement, and they are actively engaged in this process. I'll maybe turn to Jennifer Sachs, who is the Director General of the program, to speak a little bit about the concept.
I don't have time I only have 3 minutes. Do you believe that the decriminalization of fentanyl will save lives?
Our strategy to address the opioid crisis has a wide toolkit that involves quite a number of different tools. Decriminalization is one of those tools. In reducing stigma, decriminalization has been shown in different jurisdictions to encourage people suffering from addiction.
Has there been other jurisdictions that have actually decriminalized fentanyl and more lives were saved?
Mr. Viss, I just want to let you know that that is your 3 minutes, so you can work it out with Ms. Goodridge.
Thank you, Mr. Casey. It's good to see you again, my friend.
Ms. Goodridge, we've got about 2 more minutes before 7 o'clock. Go ahead.
Ms. Jeffrey answer, if she could, that question from Mr. Viss.
So there are a variety of different approaches that have been taken in different jurisdictions, and the types of substances that are included by jurisdictions reflect the use patterns that they see in their jurisdictions. The inclusion of fentanyl as part of the drug supply in Canada is what in North America in general is what makes our drug supply so toxic and what makes it so deadly to Canadians. For that reason, in order to reduce stigma, British Columbia included that as one of the 4 categories of substances in their exemption proposal.
Thank you. So I guess the short answer to that for anyone that's listening at home is no. But with that, I would like to move a motion based on some of what we have heard in our discussions, and the motion is as follows: that the committee requests the following documents: drugs approved in British Columbia under the pilot project exemption and why, choices of substance to be decriminalized, and justification for the choice and its amounts. And the department provide these documents within 30 days of the approval of this motion. Alors, en français, the committee
is asking for the following documents to be provided. If drugs approved in BC in the context of the exemption and the pilot project, and why, the choice of substances to be decriminalized and the justification therefore, and the quantities, and that the minister provide these documents in the 30 days following approval of this motion. And my apologies if the translation that I wrote here is not perfect, but I did my best.
All right, the motion is in order, but we will no longer have supports at this point in time. So I guess I'd like to do 2 things. I'd like to look to the witness to see whether this is something that you have any problem to produce that might short circuit it, and then I'll come back to the committee. Ms. Jeffrey, you heard the motion. Is that something that you're able to get your hands on and that you're able to produce to the committee?
Yes, we can provide the list of substances in the BC exemption and the rationale for which BC provided us for their request and their application.
So, well, no, we can't have a quick vote unless there's nobody who wants to speak to it. The motion is in order. You heard from the department that they're able to produce the information. The debate is on the motion. Are there any interventions on this? Or any discussion on the motion? Seeing none, are we ready for the question? Do we have consensus to have the department produce the information requested? I see consensus. The motion is adopted. I would now like to entertain a motion to adjourn.
Motion to adjourn.
Will of the committee to adjourn?
Yes.
Thank you. Thank you so much to all of the witnesses for being here. I should have done that before I adjourned, but I wanted to get to the finish line. So look, thank you all for being here. The hour is